All right, guys, welcome to the Digital Barbell Podcast. Thanks for being here. If you're new here, I'm Jonathan. Standing to my left is my beautiful wife, Blakely. If you've been around here forever, you already know that. Before we get into this amazing interview with pelvic floor specialists, really they're pelvic floor physical therapists at Austin Urology, we do have a sponsor. You guys are going to love this episode, though. I learned a ton.
Mm-hmm.
I think you learned a ton. There's some practical things that you can walk away with. If you have ever experienced any kind of leakage or urinary incontinence during exercise, it's not normal. It's common. And you're going to hear things that you can do to take care of it.
And
today.
fellas, before you turn this episode off, they said that half of their patients are men.
I was
so
surprised
this is
to hear
not
that.
a women's only episode. This is useful information for both men and women.
Yeah, enjoy.
So stay tuned.
Stay tuned.
Don't turn us off yet.
Today's sponsor is Airstream Campers.
Sweet. We're getting a free Airstream.
If you don't know what Airstream campers are,
yeah,
I can't help you. They're those silver campers that you see rolling down the road.
Silver bullets. Not a Coors Light.
Has anybody listening to this ever experienced new car fever where like something happens in your life and you just start thinking about getting a new car and you get online and maybe you go to a dealership and like it's all you can think about for the next 3 days?
You become obsessed.
Yeah. Like, we got back from this last trip to Tennessee. We were basically gone 2 weeks in the camper, and then we stayed in the camper for another week at home for reasons we've talked about on this podcast also. And we're like, you know what? Like, we could probably benefit from having a bigger camper for a lot of different reasons, which maybe we'll talk about in another episode. But so we've always liked the way that Airstreams look. It's like more of an investment. They hold their value a lot more than a lot of the campers that you see out there. They look aesthetically cool. They're high quality, blah, 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 all that kind of stuff.
Yeah.
So we went to the local Austin Airstream dealer and just like looked at them. We have not bought anything. Don't get your hopes up about that.
We've been to the Airstream dealer a few times now already because it's like, well, wait. I didn't really see this one. Wasn't sure which one did I like.
It's super. They have several different models. There's different lengths. There's different colors within the different blah, blah, blah. It's super confusing and a little bit overwhelming.
It's not confusing.
It's pretty confusing. It was at least
I'm
like
not
it's like learning a
confused.
new language.
I'm not confused.
Anyway,
I know
like
exactly
if you've heard our other podcast sponsor, Little Guy Campers, they've sponsored this podcast many times. We still love our Little Guy.
Let me tell the benefits of this of us upgrading.
I was just gonna say our Little Guy might be for sale.
Yeah.
If anybody has ever seen us post
maybe I shouldn't say anything bad about the
pictures
little guy.
and
The little guy is fantastic.
It's super high quality. Yeah,
that's what we're realizing
is
like
camper.
how high quality the Little Guy Maxes are. So when we first went into this, we wanted a camper that we could pull with our Forerunner, and it was the teardrop shape. We were within the poundage.
We didn't know anything about campers.
I sold some property, and I was like, okay, this is what we're going to invest in this, and blah 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 blah. We got the Little Guy. Come to find out, it wasn't. We couldn't we didn't feel safe pulling it with our Forerunner. So we upgraded to a truck that now we feel great pulling the Little Guy, but there's some things that it's a little guy, and we're 2 people plus 2 dogs at a minimum in that sucker, and it's tight. One thing that is a problem for me about the way the Little Guys are made is that they just put because it's so little, they just put an air conditioner unit in the camper. And so when the air conditioner's on, it is like, we're in this little camper and we can barely hear each other talk. It is loud on low. And that's like a trigger. And even in the car, I'm like, I hate air noise. And so when this air conditioner is on, unless we're sleeping, it makes me sleep good because it's just like this noise. But if we're trying to have a conversation, it's really hard to hear anything. So Airstreams, they're ducted like a house. So when your air is on, the air conditioner's on the top, you could hear them outside, but on the inside, it's through ducts and it's not overwhelming you in the camper. That's the first thing. And the second thing is since it's so small, it's where you sit is your table.
You're talking about the Little Guy?
Yeah. And so I have to squeeze in, but squeeze into my little seat. He's in his seat, and that's the only place to sit unless you're in the bed.
You're not doing a very good sales pitch for this thing.
This is just, it is a perfect camper for going a weekend or longer trip. For 1 or 2 people, it's easy to pull. You have tons of storage for what you get. We have a closet, we have a full pantry, we have tons of dish storage. It's amazing how much room they have in there. So if this is just a week, and plus it's lifted. It's like you can boondock in it. It's really cool. It's like
Got
super
solar.
cool camper. We're talking personally about being in this thing for longer term. And these are some of the things we're looking for, like a couch area where we can hang out, and then a dinette where we can work, and air conditioner where we can hear, and a bed that we can make without like we're the only piece of our bed that's exposed. Like if this is the bed, there's like 2 little slivers of the bed that's exposed. The rest of it is surrounded by walls. It's extremely hard to make.
It's a 5-minute procedure to make the bed. So whoever doesn't make their bed, this would be a great
Yeah, if
camper
you
for
don't care
you.
about making your bed. I like to make my bed in the morning. And yeah, sometimes I'm like, just do this, Jonathan.
So
Anyway.
we appreciate Airstream sponsoring this. If you could just knock your prices in half, we could make this thing happen. So
yeah, we're
keep us posted.
currently deep in the obsession of new, used, like the certain years that they ducted, started in 2016, they started ducting the air. So anything older than 2016 is a no-go for us already.
How much plasma are we going to have to
there's
donate?
There's certain looks that we like, like of course inside, anyway.
Okay, let's talk about a more legitimate sponsor. Reminder that we have partnered with Athletic Brewing. We're ambassadors of the brand. If you're trying to drink less this summer or just in general, you don't want to sacrifice tomorrow's workout, your body composition.
So Athletic Brewing is non-alcoholic beer.
The best tasting non-alcoholic brews on the market. We do not make a dime if you buy Athletic Brewing, but we can save you 20% off.
25%.
25? Man, that's a great deal. I think it's 20. It's 20.
It's 25%.
Because our code is Digital Barbell 20.
Oh yeah, sorry.
So yeah, so 20.
We get 25 off. Sorry.
So just go to digitalbarbell.com/athletic. And if you want to try it out, you will like it.
Yeah.
Is what I'm trying to say. Blakely's favorite is the Upside Dawn. I'd say it's a tie for me between that and the Run Wild IPA. And they're also only like 50 calories per can, which is way less than a real beer, certainly less than an IPA.
They recently sent me a t-shirt, so expect to see that soon.
I haven't even seen the shirt yet. I guess you threw it in the wash immediately.
Wash.
All right, that's enough of this nonsense. Let's get into this great episode with Jill and Elisa from Austin Urology. Okay, today's podcast guests, Jill Zambito and Elisa Patel, are physical therapists at Austin Urology here in Texas. You might be wondering, what does urology have to do with fitness? Well, a lot actually, because millions of women experience what's called stress urinary incontinence, or SUI, during exercise. And they might not realize just how common it is and that there are actually things that can be done to help it. So thanks for being here today, guys.
Yeah, thanks for having us.
I'm really glad that we're doing this episode because it's definitely something that Blakely saw a lot when she owned a gym. I know that women would approach her with this problem a lot, and I know it affects a lot of people, and it maybe is kind of like, people are afraid to talk about it because it's so personal, but I think it's important to bring up that there are things that can be done about it, and that's what you guys do. So before we actually get into SUI, though, I'd love to just kind of learn more about you guys, your backgrounds, how you got into this field, and why you decided to specialize in this kind of PT. So Jill, why don't you go first?
Sure. So my name is Jill. I went to undergrad at the University of Texas at Austin and studied exercise science, and then did PT school at Texas State University. And so it's a doctorate of physical therapy program. These days, physical therapists are pretty much all doctorates or doctors of physical therapy. So that is kind of my training and my background. And then right outside of school, I started at Urology Austin and did pelvic floor physical therapy for the past 2 years now. So I did all my training at Urology Austin, and all we see is anything really related to pelvic floor. So we're very specialized, and I know that there are so many people that go through pelvic floor, different types of dysfunctions, and I know that it's a very needed field. And so that's kind of why I wanted to learn more about it and get into that field.
That's awesome. What about you, Alyssa?
So I went to St. Mary's University in San Antonio. I studied exercise and sports science there. And then I went to UT Health San Antonio for our Doctor of Physical Therapy program. I graduated in 2021. Actually, Jill and I both finished up around the same time. And then my first job out of school was urology at Austin. I had a clinical rotation there. Like in the PT program, you have to do clinicals in different settings. And you get to pick like one specialty setting. And I was really interested in pelvic floor. So I had my rotation there and I loved every minute of it. It was definitely the most difficult rotation I'd ever been through because of the level of knowledge. You don't really get a lot of pelvic floor rehab like lectures in PT school. It's pretty much all outside. So I was just really fascinated by it. And so I got a job there and I've loved every minute of it. All my training has been on the job. Actually, Jill and I would be like, we were both students there and it was just always intense, but it was like really exciting. And so yeah, we both trained there together and then we've been there for the past, almost a little over 2 years. What really draws me to pelvic floor or to pelvic health PT is just how like the emotional weight that is involved with like anything wrong with bladder, bowel, or sexual dysfunction and how it affects your daily life. And I don't know, I just thought it was more, not that other areas of physical therapy aren't meaningful, but this just hits you in a different way than shoulder pain, back pain, because I would see on my rotation, I would see patients like break down in an evaluation or just, how they would quit their jobs or they wouldn't be able to go into work because of certain pelvic health issues. And so it's just really cool that we get to give people the tools and resources to heal themselves in this area of their life. So
yeah, that's really cool. I hadn't really thought about it from that perspective. Like there's not a lot of, stigma attached to having tennis elbow or patellar tendonitis or anything like that you help people overcome. But like you're having a huge impact, not only on like the person's physical health, but all those emotional things that are tied up in it too. That's really cool. Well, let's get into talking about SUI a little bit more specifically. Kind of tell us at a high level what's going on, when someone is having urine leakage during exercise.
Yeah, basically, stress urinary incontinence is an involuntary loss of urine associated with any kind of stress on the body. So stress that causes an increase in your intra-abdominal pressure. And this can happen when the force put on the pelvic floor muscles, which are like a bowl of muscles. We'll get into that a little bit later on. And when the force on those muscles basically exceed the ability for those muscles to function properly. And so then you have loss of urine. We need all of the muscles of the pelvic floor to be strong enough to basically compress and contract around the urethra to prevent leakage. So if you don't have that good support and strength of the muscles, then you're not going to be able to stop urine from coming out, basically.
So it's not really just a function of like the urethra itself being strong enough to withhold. There's things behind the scenes that are supporting things and making things happen or not happen.
Yeah, correct.
Yeah. The muscles, and same thing goes with like bowel incontinence as well. The anatomy of the pelvic floor, like all of the muscles literally like loop around the urethra, loop around the rectum. And so when those muscles tighten, like it literally closes it off. And then when they lengthen, it allows for you to empty. So that anatomy is really important to figure out or to understand in terms of why.
So how common is it? I know when I owned a gym, several women would come up to me and, tell me in private they had some, issues of like during certain movements. So I was curious, how common is it? And is there anything like in particular that predisposes women to this?
Yeah, I would say it's very common. I think most of our patients have some sort of leakage, and then there's probably a whole other, group of people that have leakage that think it's normal or they don't do anything about it. It's not usually the first thing people want to talk about, but there are certain things that predispose women and also men too, some men, to stress urinary incontinence. So that could be pregnancy, even hormonal changes in women, and possibly being overweight could just put more pressure on those muscles. Some athletes like gymnasts or athletes that are doing more jumping type activities that are just putting a lot of downward force on the pelvic floor muscles. if you've had some sort of pelvic or abdominal surgery. So in our men, like if you've had a prostatectomy or a prostate removal, afterwards the pelvic floor will weaken, and so you'll see leakage after that. Lisa, am I missing anything?
Yeah, no, those are pretty all of the good areas for sure. Yeah, I'm pretty sure that's all of it.
That makes sense.
Yeah.
Maybe this is a dumb question, but is it harmful to have this?
I would say that it's not normal to leak, but it depends on the severity of your leakage. Like I've seen women that soak multiple pads a day and do not want to leave their house because of how much they're leaking. And then others that leak just a little bit, or they only leak during their workouts. And so women are like, oh, like I want to do more plyometrics, but if I do, I like need to stop and go change my I need to go change my underwear. Or it's very little and they're just like, it's just really annoying and I've put it off so long that I'm finally doing something about it. And that's what's crazy is like a lot of women we see will have dealt with some form of leakage for so long and they never knew about pelvic floor physical therapy, or they just thought it was normal and they just put up with it, and then it kind of gets gradually worse and they're like, okay, it's gotten too far, so I need to do something about it.
Yeah, I agree. I think it's maybe not necessarily harmful, but it's definitely a sign from your body that something is out of whack, and so you want to address that sooner rather than later, before things, like Elisa was saying, kind of get out of hand, and then you might develop these other issues as well.
So maybe it's harmful in as far as it like impacts your quality of life.
Yes.
Exactly.
Yeah. That's what's go ahead. I was just saying. Okay, I was just gonna say that that's just pretty mind-boggling to me how like, some people come in and they're just like, I seriously don't leave the house. Like I dread going to the grocery store. Like I dread, going out in public to a restaurant, things like that, because the level of leakage could be that bad for some women and men too. I think it's really important to like Jill and I would say like half the patients we see are men. And anything that goes on with pelvic floor dysfunction with women, same thing can go for men because we all have pelvic floors.
Yeah.
So.
What we mentioned, some of the exercises or things we can do in training that can be potential triggers. Can we kind of talk about what are the things that are most common for people to see symptoms with, to maybe kind of normalize what people are going through?
Yeah, there are lots of different exercises that could lead to leakage, but some of the big ones, like I said, any kind of jumping activities, so like kind of like your HIIT training, or even like power lifters, so deep squatting, possibly lunges, deadlifts, things where you're carrying heavy weight. And the pelvic floor muscles are going to be working because they are part of our core. They help with stabilizing us. So in any of those type of exercises, our pelvic floor muscles are going to reflexively contract and be working. But again, if they're not strong enough to support the load that you're lifting, that's what can lead to leakage. And then you also, go ahead, Elisa.
Okay. I was just wanting to piggyback off of what you're saying. A lot of them, whatever sport they're doing, whether it's CrossFit or runners or whatnot, they spend a lot of time training in like their specific sport or their specific activity and not really training the pelvic floor. And that can be an issue because then, with lifters and runners, like they're all about getting strong and skilled in that specific sport. So what can happen with the pelvic floor muscles is they can become very tense and shortened, just like anywhere else, because we're training like nonstop in that specific area. That tension is what is leading to leakage, because if we haven't already gotten into this, but with leakage, if those muscles are already shortened, and then let's say you're lifting or running, and then your pelvic floor is trying to shorten even more to hold back urine, it can't. And so it goes the opposite. We kind of use this analogy of like squeezing imagine like a toothpaste tube, and you squeeze in the middle of it, and there's a cap at the bottom. Well, if that cap is nice and strong and like has good mobility, the toothpaste isn't going to leak out of the tube. But if you squeeze it too hard and the cap isn't on efficiently, then it's going to leak out the toothpaste. So that's what's important important that we teach a lot of our patients is like training your pelvic floor muscles is equally as important as whatever sport or activity that you're doing.
Yeah, I think that's a really good transition into kind of talking more about what exactly is the pelvic floor, what are the muscles that make it up, what's the normal anatomy of it, what are some of the dysfunctions like you already started talking about here, and then we can kind of get into how we're going to address this from like a rehab perspective.
Yeah. Our pelvic floor muscles, to put simply, are a bowl of muscles, and they provide bowel, bladder, and sexual function. So these muscles connect in the front at our pubic bone, and then go back into our tailbone, connecting to our tailbone and sacrum. And then they also expand side to side from our hip bone. So they support our pelvic organs as well. And they are necessary for, like we mentioned, making sure we're not leaking on ourselves, whether that's urination or fecal incontinence, fecal leakage. They provide us with, appropriate sexual function, and they're a part of our core. So they're working to support and stabilize our bodies. Elisa, what do you have to add to that?
Yeah, so I want to address more on like how they're a part of our core. So the front of your core is like all of your abdominal muscles, okay? And then the back of your core is your thoracic lumbar spine and all of the muscles around the lumbar region. And the bottom of that is our pelvic floor muscles. And then the top of that is the diaphragm. And we'll get into that a little bit more later on treatment, because diaphragm mobility is really important. Anyways, so think about it like a soda can. And so if you kind of can picture a soda can, the top of that can is the diaphragm, bottom is the pelvic floor, front and back is what I said earlier. So all of our activities that we're going through, like when we lift, when we use the restroom, when we, not even like exercising, but like lifting something heavy into your car, groceries, whatnot, our pelvic floor has to withstand all of the demands that are placed on our pelvic floor. And so you may not even know it, but you're probably doing like with squatting, with deadlifting, and then in things that we do in our daily life with squatting and heavy lifting, our pelvic floor is contracting to prevent leakage from happening. So the mobility of our pelvic floor is so important, and a lot of us don't realize how important it is, because if we did not have our pelvic floor muscles, like Jill said, it's literally everything at the bottom. If we did not have that, all of our organs would like sag, So like really realizing how important the pelvic floor is and the support that they provide, it's pretty cool.
So when you say mobility of our pelvic floor, what do you mean? Like, is it like the strength of it or the way that it moves
good
around?
Yeah, good question. So your pelvic floor muscles, think about like a bowl, okay? Good mobility, they need to have good strength. They need to be able to contract, okay? So that's like a lift and tighten. And then that they need to be able to lengthen and drop. So in order for you to empty your bladder and your bowel, they need to lengthen and get out of the way. And same thing with like doing like a vaginal birth. Those muscles need to be able to widen and lengthen to get out of the way. So having good mobility, contracting and lifting upwards, and then dropping and lengthening downwards, that's the mobility that is key to having optimal pelvic floor health.
Okay.
So when we teach our clients to brace for heavy lifts and just gym safety in general, we use the Valsalva maneuver where we fill the inner abdominal cavity with air and then we brace against it. So basically the pelvic floor is the bottom source of holding all that pressure in. And if I'm understanding this right, if it's strong, we maintain everything inside as we're braced in that position. And then if we can go through a full range of motion with the pelvic floor, we're able to relax it and pass urine and everything else normally and in the relaxed position. Am I understanding that right?
Yeah.
Yes. Yep. Yeah. And, when you're not able to, Lisa touched on this a little bit, but properly coordinate the contraction between your diaphragm and the pelvic floor muscles. So if you don't have that mobility between the two, so if they're both not able to properly expand and contract together, that's when you start to run into some issues, because when you're bracing or using load, you're putting a lot of that pressure just straight down onto the muscles. And so if they're not properly lengthening to regulate pressures in the abdominal cavity, you could have dysfunction or leakage, whatever it is.
So I also wanted to mention that a lot of us, especially with anybody that's really engaged in workouts and whatnot, we have very tense pelvic floor muscles. So a lot of us struggle with the ability to lengthen or drop our pelvic floor, because think about it, everybody's doing squats, deadlifts, and working on their power or whatever movement that they're focused on. The ability of those muscles to drop and lengthen is important. And so when we don't have that, that's when leakage happens. So it's one extreme or the other. So basically you can have tight pelvic floor muscles and leak, and you can also have weak pelvic floor muscles and leak. Okay, and we explain that concept all the time with our patients.
How do you diagnose that to figure out which end of the spectrum people are getting symptoms from?
Yeah, good question. So first, like when you are going to be evaluated by a pelvic floor therapist, we're going to ask you questions about your bladder function, bowel, and sexual function. So we kind of have a list of questions that we ask. If we're looking for tension, or if I'm kind of thinking like, okay, this person may have tight pelvic floor muscles, they may have bladder-wise, they may have urgency, they may have frequency, meaning like they have to pee often. Urgency means they have to, like, they really got to go all the time. They can't hold it. Maybe I
know that feeling.
Yeah.
Diagnosing me right now.
Yeah, and they maybe don't feel fully empty. Some patients are like, gosh, I just peed and I feel like I have to pee some more. And maybe discomfort with urination or waking up frequently at night to pee. And Jill, you can keep going if you'd like.
Yeah, no, those are like the big ones.
Yeah.
And once we get our kind of subjective histories, which could tell us a lot, we can just from that, we can tell usually if someone is more on the tension and tight side versus the lax and loose side of things. But from there, we'll kind of confirm our hypothesis with an internal examination. So testing the strength, the coordination, endurance of the pelvic floor muscles. So basically having them perform a Kegel while we're internally with one finger, so that we can actually feel those muscles. And then we'll also assess for tension around the muscles as well.
What about on the opposite end of the spectrum?
Yeah, so maybe someone they don't have urgency or frequency, they just leak, and it can be leakage like with walking, or leakage with at the end of the day, after a lot of activities, at the end of the day, they leak more. That's a sign of a lack of endurance in those muscles. But now if a patient comes in and they just leak with lifting heavy, sneezing, coughing, laughing, that gets a little tricky because it could be both tension and weakness. And so that's where an internal exam is important to figure out. So that's why it's important to be evaluated by a pelvic floor PT before you self-diagnose and think, oh, I just need to do Kegels or whatnot. Because sometimes Kegels, well, it depends. That's not always the answer for our patient.
Depends how good they are at Googling their symptoms and finding what they're supposed to be.
Yeah.
Do you find that, like, the person listening to this podcast probably resistance trains, does cardio also. Do you find that active population skews towards one direction, tightness or weakness, than a sedentary crowd?
Yeah, 100%, mostly tension.
Yeah.
I kind of thought so.
Yeah, most commonly at the gym, it was like jumping, like jump rope or jumping on a box was like really the main issue with if women came to me. And it's like, these are the two things that are like my triggers, and that I'd prefer to not do these.
Right. Yeah.
Obviously, you can't diagnose anybody over this podcast or write a training program for them to fix it. But so let's just kind of stick to the assumption that the person that's experiencing this, listening to this, is probably on the tight side. What are some of the first steps that you take with your patients that are showing symptoms because of that?
I would say the first thing that I will teach them is proper breathing. So we're huge on diaphragmatic breathing. So we keep kind of referencing this, but we have our diaphragm that sits underneath the rib cage, and then you have your pelvic floor muscles, which the two have to work together. So as we breathe diaphragmatically, you're going to inhale into your belly or into your rib cage. And as you do that, your diaphragm is going to descend downwards, and to help regulate pressures in the abdominal cavity, our pelvic floor muscles are also going to descend downwards. So that that descension of the pelvic floor muscles helps them to lengthen and stretch. If you have tight muscles, that's what you'll want to do. You'll want to retrain those muscles to learn how to lengthen and stretch. And then as you exhale, diaphragm kind of lifts back up and pelvic floor muscles are going to lift back up. So it helps with lengthening and stretching the muscles, but it also is going to bring more awareness to those pelvic floor muscles, help with coordination of the muscles, and just better motor control overall. And so we tell our patients that are presenting more as tension to do like 10 diaphragmatic breaths every hour throughout the day, because a lot of times people with tension, they are going to be gripping in their abdomen, their glutes, their inner thighs. They're always tensing those muscles without even realizing it. So doing the breathing is just kind of a cue for our body and our brain to like let go and let those muscles relax.
Yeah.
It's almost like you're switching your nervous system over to the parasympathetic.
Yep.
Yeah, absolutely. Yeah.
100%.
And I think too, a lot of it is educating our patients. First, we always start off after we've taken all of our questions before or after we do internal exam, explaining to them the mobility of the pelvic floor and what we're trying to get at is important for it to just click in their heads. And then making sure that they know, like, try not to hold your breath during the day, or like try not to clench your jaw all day long. A lot of us are, and I'm guilty of it too, like walking around with our belly sucked in and like want to have good posture and everything, but that is probably leading to most of the tension, because if you're walking around sucking it in all day, barely taking a deep breath into your lower abdomen and pelvic floor region, that can lead to tension. And so if that's the pattern that we've been adapting to most of our lives, they come to us and they find that it's a really hard time to do the diaphragmatic breathing that we ask them to. Yeah. I had a friend that's a personal trainer, and I remember I was teaching her how to do diaphragmatic breathing, and I had the hardest time with her. She was just like, this is just the opposite of what I do. And I'm like, yeah, exactly.
Do you guys have a resource that we can share in the notes to this episode about how to do that kind of breathing?
Yeah, we have a handout that we give, and we can also send a YouTube video link that will give further instruction.
That's perfect.
Yeah.
Because I'm kind of curious, like, what does it feel like? You know, I've done deep breathing and, you know, meditation type things and box breathing and that kind of stuff. Is there anything that you should feel when you're in your pelvic floor when you're doing this right?
Mm-hmm. You should be feeling like a slight drop bulge, like in your anus. That's what we try to tell patients. And so, like, if you're sitting on a firm chair and you feel like both your sit bones, if you take an inhale, you want to think about sending the breath low. Like I tell patients, visualize your pelvic floor like lengthening, and you should feel your anus move closer towards your feet. And it just takes a lot of practice, a lot of retraining to have that awareness of what they're doing. Most patients, it takes a couple tries to feel that.
Good news is you can like do this at work and basically get paid to practice this. You're just sitting there in your chair, nobody's knowing.
Yeah, and that's what we tell patients to do. Like do this wherever you're at, when you're sitting, when you're standing, when you're walking. Just try to incorporate it in your day, because it's so important. Because all day long we're holding our breath, clenching everything in between our core, when we need to try to do the opposite to achieve that mobility and flexibility of the pelvic floor, just like any muscle in the body. Like if you think about it, I also tell patients too, like when you're doing bicep curls, like you're not just gonna keep doing bicep curls all day long and like holding that and the entire time. Like you need to also have that good flexibility in that muscle. And so the pelvic floor is sort of the same way in a sense.
Yeah, that's interesting, because it's opposite of what we would think. We would think if we're having an issue, we should be not relaxing, you know. It's too
loose. We got a problem.
So if in addition to the breathing, are there any particular exercises, say people are active or not active, like that they could, you know, be doing, like just air squats or bird dogs or some of the things I might have, you know, heard of, but is there anything in particular that people can do?
Yeah, I mean, good, you know, general strengthening around the pelvic floor muscles will be important. So we do give like more focus on deep core activation. So deep core is more of our transverse abdominis, our diaphragm, some of our back muscles. And so getting connected to the deep core will help more with properly, using our core without just relying solely on our pelvic floor muscles to help stabilize us during our functional activities or exercise. So we will give, like for dogs, or just the transverse abdominis activation, where it might seem easy, but you're basically just laying flat. You're coordinating your deep core contraction with your breath. So inhale, belly expands. Exhale, think about drawing rib cage together, hip bones together, holding that through the end of your exhale, and then gently relaxing. So training your core how to work with your breathing. And of course, if you're seeing us in person for an assessment, we look at, joints above and below the pelvis too. So we're looking at the knees, the feet, your hips, because if those muscles or joints are also not functioning properly, then we want to address that too, because that'll be throwing off how your pelvis is functioning. But as far as exercises go, based on our assessment, we may give specific exercises, but definitely deep core contractions, like deep core exercises, like I mentioned.
Yeah. Honestly, sometimes those are the hardest things to make yourself do, because you're just, it's like, what am I doing? Am I doing anything? If it is, yeah.
Like, I only have 30 minutes to train. I'm not going to see this in the mirror. Why am I doing this?
But you realize how important it is.
Yeah. I think too, if we're working with a patient that just has like all the tension throughout their core and pelvic floor, and they just need to work on relaxation, then we also like to teach a couple of yoga poses, like happy baby and child's pose. And I like to have patients do their diaphragmatic breathing in those postures to really facilitate that length in the pelvic floor. So that's kind of like the two that we like to give. And then of course, general hip mobility stuff. Because, not a lot of us could definitely benefit from hip mobility if a lot of us are sitting at a desk for 8 to 10 hours a day, and really stiff in the core, stiff in the front of the hips. So doing things to counteract that is also helpful for achieving pelvic floor mobility.
Yeah, that makes sense.
Yeah.
Does this ever get bad enough to where surgery is on the table?
Surgery?
Yeah, I would say yes. I've seen patients that will do like a bladder sling surgery, and that's where the urologists come into play. So we work in the same clinic as the urologists do, and so any women, maybe it just depends on the severity. I think too, lapse is the issue, or is the driving force behind their leakage. Depending on the severity of their prolapse, they may need surgery. It just depends though, but it can happen.
So does that mean like they insert something that basically supports the weight of the organs that would normally be pushing on the pelvic floor because they're not strong enough to hold on their own?
Yes. So depending on what surgery that is that they're having, it is an external like support, because the own tissues, ligaments, muscles aren't sufficient enough.
I would assume that's like a last resort, as with any surgical intervention.
Yeah, absolutely. We see a lot of patients that are like, I'm here because I don't want to have surgery. I'm like, great.
Yeah. And one other thing to add to that is that I feel like surgery often will cause pelvic floor tension or dysfunction, or make it worse. So the more, you can avoid surgery in general, the better.
Yeah.
So just to kind of start to wrap up, like what I'm hearing you say is there is hope. If somebody, man or woman, is experiencing this right now and they're like, first of all, I'm weird because this is happening. You're not weird. It's super common. If you feel like it's never going to get better, I think what you guys are saying is you help people make this get better every single day, right?
Yeah, absolutely. Knowing that urinary leakage is not normal and you don't have to deal with it. There is somewhere you can go. So, if it's something that on your own, it's not getting better, go see a pelvic floor physical therapist, and they can really assess your muscles, your joints, and kind of your movement habits and patterns, and they will help you find the root cause of your issues and give you a good plan and program.
Yeah, there is hope. I think too, so many patients that I see, once they start to see results, they're like, why didn't I do this sooner? Like, I can't believe I put this off way too long. And I'm like, I know, like, this is an investment in your health and your well-being. And like I said, how impactful pelvic floor rehab can be, just because of like the emotional connection with like your bladder, bowel, and sexual function. It's important. So,
Yeah.
but I see that in like a lot of moms, like, so moms that have had like multiple kids, they're just so busy and they're being such great moms, and they're like, I just don't have time. And then finally they come in, they're like, okay, I definitely need to make the time for this.
We have clients like that too, so totally get it. Hope they listen to this episode. Was there anything that we missed that you think would be
Yeah.
important to throw in before we go?
I don't think so. I think that's a good overview. I would just say bottom line, Kegels, although that's kind of been what's out there. If you, like you said, Google, that's like the first thing that comes up. So I would say
Yeah.
don't just blanketly do
Yeah.
Kegels to try, because
Yeah.
that often will make things worse. So
Worse.
do diaphragmatic breathing. But again, if you're having trouble with these types of things, I would go just get it assessed and see what's going on.
Yeah.
I'm glad you brought that up.
Yeah, for sure.
Yeah. All right, guys. Well, in the
Yeah.
case that
Take home
somebody is here in Austin, in the Austin area,
Yeah.
what's the best way to find your clinic? And if they're not in Austin, where should they start?
Yeah, Teresa.
So Urology Austin has multiple locations. I work in Cedar Park, Round Rock, and Georgetown locations. And then Jill is south of Austin. And so if they can, so our patients normally are already Urology Austin patients, but you don't have to be a Urology Austin patient. We see patients that are referred to us from gynecologists, other urologists, OB-GYNs, things like that. And so their doctor will just write a referral for pelvic floor physical therapy, and we can see them. There is a wait list though, and it's like this everywhere with pelvic floor therapists, because there's just such a need. And
So basically,
Yeah,
if your insurance requires a referral, probably start with your GP, your gynecologist, something like that. Get a referral for PT.
Yeah.
Just like it was at your shoulder or your wrist or something.
Yeah.
Yep.
Yeah. And, don't be afraid to advocate for yourself. So sometimes a provider isn't going to suggest pelvic floor physical therapy, but that is absolutely something, you can bring up to your provider and say you're interested in it. And I'm sure they'll have no issues referring you to pelvic PT.
That's awesome.
Yeah. Even too, like, you may not think that you need it, but then like I think it's a good idea just to see a pelvic floor therapist just in case, because we may uncover something that you didn't realize was an issue, that there is actually things that we can do to help or improve whatever it is that you are experiencing. So yeah, it's just like you're going to see your primary care physician. I think us physical therapists, I think we are really undervalued, and we can offer a lot in terms of musculoskeletal. We are musculoskeletal experts. And so I think it's just important to get a good evaluation by a physical therapist for any joint, anywhere in the body, just to see.
Yeah, you guys had to go through the whole DPT protocol before you specialize, so you know a lot about a lot of things.
Yeah.
Awesome.
Yeah, it's good.
Well, we definitely appreciate y'all's time today, and I know people will get a lot out of this. I hope that it's done something to kind of break down the stigma and make people realize that they can get help. So thanks again for your time.
Yes, thank you all so much.
All right.
Yeah,
we'll put the links to all the
blast.
resources that we talked about in the show notes of this, including the breathing exercises too.
Yeah.
So, all right. Thanks again, guys.
Thank you so much.